Sells with market timing at Online Trading Academy. Learn the right way to trade stocks, options, futures, and Forex. Remember Brexit? That was timing. We knew the date. It hit, and boom. Market went down 600 points. Banks and institutions made money. Did you? Or did your broker or advisor just let your money disappear? Well, the next big timing moment just might be the Obamacare rate hike November 1st. See how pro traders deal with timing moments like this and many others at a free half-day class in Broward and Palm Beach at Online Trading Academy. Learn how money is made in up, sideways, and down markets. They've been around 2 decades. Reserve a pair of seats for you and a guest. Online Trading Academy. Call 561-674-9800. 561-674-9800. 561-674-9800.
If you suffer with diabetes, there's a 25% chance that you'll develop a foot ulcer that can lead to severe health consequences, including amputation. At the sole authority, at little or no cost, you can receive your very own therapeutic shoes and custom inserts. Medicare recipients are entitled to 1 pair of quality diabetic shoes and 3 custom inserts. Call the Sole Authority today, 954-597-7060.
What you want to know. What you need to know.
Talk 1470. WNN.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Medicine continues to change every day, and the doctors responsible for this are now doing what they can to share this information and news. Introducing Regenerative Medicine with Dr. Escobar, a new approach to pain management here in Florida. Dr. Escobar is board certified by the American Board of Anesthesiology, the American Board of Pain Medicine, and diplomat of the American Academy of Pain Management. He has been practicing in the area for over 15 years. He has lectured in the community as well as mass media on various topics in pain management. As a leading provider of interventional pain management in Aventura, Pembroke Pines, and Hollywood, Dr. Escobar works hard at treating the source of your pain with the goal of restoring you to full function in your normal life and activities. If you wish to join the conversation or have a question, please call 888-565-1470 and talk with Dr. Escobar. Now, here is Dr. Escobar and today's show.
Hello, and happy Monday. Welcome back to the Regenerative Medicine Show with Dr. Luis Escobar. I am your host, Tracy Kawa. Dr. Escobar is the sole practitioner at Pain Care Specialists of Florida. Thank you for tuning in to 1470 AM on your dial. Dr. Escobar, are you with us?
Yes, Tracy, good afternoon. How are you?
I'm good. How are you?
I'm very well, thank you. Joining you from Orlando, Florida. We're attending a meeting. And so hello from warm Orlando.
How nice, how nice. Well, I miss you in the studio with me. Thank you for calling in. I'm used to seeing your smiling face, bringing your good energy, sitting across from me usually. So we're going to have a great phone interview today. Dr. Escobar, for those who haven't joined us yet, he is el Doctor de los Milagros. He's a double board certified doctor of anesthesia and pain management. His practice is dedicated to interventional pain management. He has 3 offices in Hollywood, Aventura, and Pembroke Pines. So last week we discussed the processes of platelet-rich plasma and stem cell therapies for regeneration and for pain treatment. So this week we're going to be talking about something very exciting. We're talking about one of today's greatest basketball players, Kobe Bryant. But first, I want to address the silent sufferers out there. You or someone you know might be suffering chronic joint pain in your back, pain in your elbows, pain in your joints, your wrists. You don't have to go it alone. I want to invite you to join the conversation with a compassionate doctor who cares. The doctor who has done years of research before incorporating PRP and stem cell therapy into his very own practice. Dr. Escobar is your partner in your healthcare journey, helping you to step back into your optimum performance and getting you back to your day-to-day activities with freedom and without pain and discomfort. So call in as we speak to Dr. Escobar. Remember, you can call in at any time to ask a question or even to find out if you're indeed a candidate for PRP and stem cell therapy. Call in 1-888-565-1470. Again, why live in pain? Call in now with any questions for Dr. Escobar or to find out if you're a candidate for stem cell therapy at 888-565-1470. Okay, so Dr. Escobar, in honor of Kobe Bryant's birthday, which is tomorrow. Yes, he's going to be 38 years old tomorrow. He's a Virgo. We're going to be discussing his platelet-rich plasma therapy. So first, Dr. Escobar, can you briefly describe again for our listener on 1470 AM what PRP and stem cell therapy is before we get into the conversation about the superstar?
Yes, will be a pleasure, and happy birthday to Kobe Bryant. Great fan here. The purpose of the treatments with stem cells and platelet-rich plasma is to enhance the regenerative powers of the body. These are substances that are inside our bodies already. And taking a step back, I would like to tell all your listeners that every time that we sustain any type of injury, we activate all these cells and chemicals in our body. When an injury happens, there's a cascade of chemicals, including growth factors, cytokines, that are coming to action to call into the area of injury of all these cells to try to regenerate the injury. From the minute the injury happens, this process commences. Sometimes, if the injury is too large, the body is not able to attract enough cells and growth factors to the area of the injury, so the healing process does not take place appropriately or not at all. And in this case, we can have a chronic injury with chronic pain and disability. So what we do is try to help our own bodies by getting the cells from within the body, harvest them from the blood, processes through special centrifuges, separate the cells that are not needed for inflammation, for healing rather, and then put them together with stem cells that are harvested from the same patient, also put them together and precisely inject those cells into the injured areas to promote the healing process. And this is basically what it is a magnified regenerative process that would have taken place, but when the patient doesn't have enough cells in the area, that we bring those cells to the area to take care of the problem.
So essentially, Dr. Escobar, it's harnessing the powers of the body to heal itself, giving the cells a boost and re-injecting them back into the exact site of pain?
Correct. It's a matter of numbers. We collect the cells from where they are within the body, in the bloodstream. They're circulating in our bloodstream, the platelets are, and the stems are located in different parts of our body, and pretty much all the tissues. The most common areas are the bone marrow, which is the inside of the bones, mostly the larger bones, such as the femur and pelvis, and in the adipose tissue, which are the most abundant.
The fatty tissue.
Yes, ma'am. So the process is to go and collect those cells, separate them from all the tissues that are not needed or are detrimental for healing processes, and then precisely put them in the area they're needed so the healing process takes place.
Well, I'll tell you, modern science is so fascinating to me, and I'm sure to a lot of our listeners out there. So getting back to our topic for this week, Kobe Bryant, there have been numerous articles written about Kobe Bryant flying over to Germany a few years ago. Articles from I Want What Kobe Had to articles about why did Kobe go to Germany. So I know you're familiar with some of these articles, Dr. Escobar. Can you tell us why indeed Kobe Bryant went to Germany?
He went to have some treatments that involve using his own blood that is treated, and some of the substances in the blood are separated and re-injected into the injured area. I believe that he was mostly treating his knees. The treatment that he underwent in Germany is basically a platelet-rich plasma treatment, performed a little bit differently through a proprietary technique that they use in Germany. This technique was developed by a neurosurgeon in Germany, and what he does, he heats up the platelet-rich plasma or the blood as it's spun and separated and develop a technique to extract a protein out of the patient's blood. They refer to this as IRAP, which is interleukin-1, which is a cytokine that is in the blood, interleukin-1 receptor antagonist protein. And this protein has been shown to have some regenerative properties in the prevention of osteoarthritis.
So the interleukin-1, Dr. Escobar, is a natural anti-inflammatory, is it not?
It is a pro-inflammatory in some instances. So what we're trying to do with that, what they're trying to do while using it is to antagonize its effect. So that's why it's called interleukin-1 receptor antagonist protein. So it works against. So the interleukin-1 will be one of the substances that will kind of promote the inflammation.
So it's antagonizing the inflammation in the body to reduce the inflammation?
Correct. Yeah, antagonizing that the interleukin-1 will decrease the inflammatory process.
And promote healing and regeneration, essentially.
Promote healing and regeneration, yes. That treatment is not available in the United States, but interestingly, the important thing for you listeners to understand and to know is that interleukin-1 and the antagonists exist already in the blood. So what they have developed there is just a process on when they kind of get this receptor by itself, not the receptor, but the protein by itself, to re-inject it into the area. But when we are doing a platelet-rich plasma treatment, we're actually given the IRAP itself together with other growth factors to promote the healing. So we are achieving relatively the same results with platelet-rich plasma treatment.
So what I hear you saying is that it's taking something that already exists within the body and then maybe spinning it in such a way that it isolates the interleukin-1 and then re-injecting it into the body.
That's correct. That's correct. Separating that particular protein by itself. When we are doing a platelet-rich plasma treatment, we are providing that protein together with other growth factors and other cytokines, more substances that promote the healing process. So we are achieving the same result that will be achieved by injecting the IRAP alone.
And it's allowing the body to use its own natural resources.
It is the natural resources that are going to the area of injury to do the job and repair the injury. Basically, the stem cells are pretty much your contractor, your repairman, so to speak. And the platelet-rich plasma with all the growth factors, cytokines, are the tools that the repairman is going to be using to do the repair job. So the best treatment that we can provide today for a patient with an injury in joints or soft tissues It's a combination of both, which is the stem cell treatments together with the platelet-rich plasma.
So a combination of both the PRP.
Yes.
So
those are injected into directly either under fluoroscopy or ultrasonography directly into the injured area.
Dr. Escobar, we're going to talk more about this when we return from our break. Again, to our listeners, Why Live in Pain, call now with any questions for Dr. Escobar, or even to find out if you are indeed a candidate for stem cell treatment and PRP treatment. If you want what Kobe had, call in Dr. Escobar and ask him any question at 888-565-1470. Again, that's 888-565-1470, and we'll see you after the break.
Get your life back from musculoskeletal injuries faster and without surgery. At Pain Care Specialists of Florida, Dr. Luis Escobar can help you do just that with regenerative treatments of platelet-rich plasma and stem cells. Stem cells live in all of us and act like the repairmen of the body. However, during injuries, we sometimes can't get enough of these critical repair cells to the injured area. This is where Dr. Luis Escobar may help you by harvesting your own stem cells and re-injecting them into the injured area in need of repair. To find out if you are a candidate for regenerative treatments with platelet-rich plasma or stem cells, please contact Dr. Luis Escobar at 954-322-8586 to make an appointment at one of his 3 conveniently located offices in Hollywood, Pembroke Pines, and Aventura. Or visit us on the web, www.painconsults.com. You are listening to Regenerative Medicine with Dr. Escobar. And if you wish to ask a question or participate in the show, call 888-565-1470 and speak to the doctor. Now, back to the show.
Hello. So if you want to catch us live, check into AMP2 TV Productions on our Facebook page. We are live right now. You're listening to 1470 AM on your dial, and we are speaking with Dr. Luis Escobar on the Regenerative Medicine Show, and we're discussing Kobe Bryant's PRP treatment that he went to receive in Germany. Dr. Escobar, are you with us?
Yes, Tracy, I'm here. Thank you.
So one of the things that I'd like to talk about is, I'm sure you read in many of the articles that athletes apparently have some kind of U-curve of productivity where they peak at a certain age, which is usually in their early to mid-20s. Then they plateau. Then they start declining all before the age of 30 years old. So, I remember reading, one of the articles was essentially talking about the fountain of youth, that Kobe tapped into this regenerative, restorative source when he went for treatment. Can you comment on that for us?
Sure, I can. I kind of disagree with this being like the fountain of youth. I don't think that the treatment that he underwent improved his overall ability to play basketball for a longer period of time. It allowed his injured knee to perform to the ability of the rest of the body. And therefore, he was in a great enough shape that improving his knee, he improved his game to pretty much the top of his career. I mean, I believe he had one of the best seasons ever.
Yes.
For retiring. So, but yes, it helped a lot that he had his knee much better, and he believes, and I believe that the treatment with the IRAP and the platelet-rich plasma had a lot to do with that, together with his hard work, of course.
So what you're saying is it really brought his injured knee up to speed with the rest of his body.
I am a believer that it did help, and obviously so did he, because he kept going back for the treatments. So I don't know exactly what was the motivation, but he obviously needed extra help recovering from the injury.
So what have you seen? Which which sports have you seen alleviated, let's say, by PRP and stem cell therapy? Tennis, golf, an avid tennis player who's injured. Who can be helped with PRP and stem cell therapy?
Basically, any athlete or any individual patient that has sustained any of the injuries to the soft tissue that athletes suffer can be benefited by this type of treatment. In my practice, we haven't had the luck to treat famous athletes
yet,
but we do treat the weekend warriors, and we treat the golfers like myself. That we go out there and embarrass ourselves every day, golfing and hacking, and eventually have some injuries. We can definitely help those. Can help the runners. Patients that have the shoulders, elbows, knees, back problems, degenerative disc disease, disc herniations, any soft tissue injury is amenable to the treatment with platelet-rich plasma and stem cells.
What's the current average age of your patient right now?
We treat anybody from 18 years until, I think, our youngest, oldest patient, and my youngest, I call him, I think, is 101.
Whoa!
So we do not treat pediatrics at this time. So our youngest patient will be 18 years old.
Nice. 101. I'm just curious. I just want to know for myself. I'm sure our listeners on 1470 AM and our Facebook Live want to know, what was the 101-year-old coming in for? What were they coming in to treat? I mean, they must have been somebody who was still young enough and active in their lifestyle to come in.
Interesting enough, it's for back pain. And every time this gentleman comes to my office, I tell him, I think that we need to switch seats because I need to be asking you what I need to do to stay in the state of health that you are.
Yeah, share it. Share the information.
Absolutely.
Let's write a book about it.
Yeah, one thing that we cannot change at this day and age is the genetic markings. So that comes embedded into your genetic markings, and some people have those better genes than others. So, but the ones that we can change is the tissues that we do have, and they have injured. And we have the ability to help anybody who has any soft tissue injury. In my practice, we restrict the practice of the degenerative treatment to the musculoskeletal system, and that includes the spine, the hips, the knees, the shoulders, foot and ankle, any joint in the body, any muscle that has any tears or damage is definitely amenable for this type of treatment.
So, Dr. Escobar, one of the articles online said this sentence here: the grind of the season starts to dismantle the body. Joints give out, muscles lose their fast twitch fibers, tendons are torn, and it's the usual tragedy of time, only accelerated by the intensity of professional basketball in the case of Kobe Bryant. So it sounds like these are the natural progressions and signs of aging, right? Would you say muscles lose their fast twitch fibers, tendons are torn? So it seems to me, and probably, becoming more clear to our audience, that PRP and stem cell therapy can, in fact, enhance an otherwise healthy lifestyle. Can you speak to that a bit?
Yes. Like I mentioned before, the aging process is not going to be reversed with this type of treatments, but we can, for sure, put an injured area of the body in par with the rest of the body. So, and that's pretty much what happened with Kobe. I mean, he is a tremendous athlete in the best shape possible, but his knee wasn't. And so the knee could not keep up with the rest of his body, and that's what we intend to do when somebody presents to my office with an injury. We treat them to put that particular part of the body with an injury in par with the rest of the body, so they can have their normal life that we're having before the injury. So we're not trying to make them younger. Or to give them any more stamina. This is not steroid treatments or growth hormone treatments. No, this is the patient's own cells taken out, put them back into the area they are needed for the proper healing. It's extremely safe procedure, and the rewards are tremendous.
Is that what is known as biologic medicine? Does PRP and stem cell therapy fall under biologic medicine?
Yes, the AMA has referred to that as a biologic medicine, yes.
Interesting. I'm just reminding our listeners and our viewers on AMP2 TV Productions Facebook Live that if you have any questions or if you want to call in to speak with Dr. Escobar, find out if you're a candidate for PRP or stem cell therapy, call in at 888-565-1470. Again, 888-565-1470. So, with our 5 minutes remaining, I'm curious, what are you learning up there in Orlando at your convention?
No, this is a different type of my practice. This is a workers' compensation convention for the state of Florida, and we do deal with injuries that happen at work as well as sports injuries. So we are making presence here.
Occupational injuries?
Well, workers' compensation treats every injury that happens at work. So it's just a type of insurance that is carried by companies on their employees. And if an injury happens at work, then they're covered under that particular type of insurance as opposed to their own medical insurance. So it's just an insurance thing. It's not different treatments. We treat all our patients the same regardless of insurance, and we give the best possible care to each one of them.
Very nice. Very nice. Any last minute thoughts or words this week for our listeners?
Well, we are at their service in Hollywood, Pembroke Pines, and Aventura. We have 3 offices. We'll be very honored to treat any of your listeners, evaluate their conditions, even if you have been told that this is a chronic pain and you have to live with it, whether you've had surgery or not. Sometimes patients will have had surgery, have chronic pain thereafter, and they're very amenable to and respond very well to this type of treatment. So whether it's before, during surgery, or after surgery, you are a candidate for regenerative medicine.
Well, Dr. Escobar, thank you again for another lovely week of conversation about PRP and stem cell therapy. I'm looking forward to seeing you in the studio next week, hopefully. Why live in pain another day? Call now to speak with one of the friendly staff members at Pain Care Specialists of Florida. Remember, Dr. Escobar is your partner in your healthcare journey. Schedule an appointment with Dr. Escobar today. Find out if you're a candidate for PRP and stem cell treatment. 954-322-8586. Again, 954-322-8586. Thank you for joining us on the Regenerative Medicine Show.
You have been listening to Regenerative Medicine with Dr. Escobar. Join us every week for more information and news on achieving full function in your normal life and normal activities. Call Dr. Escobar for more information at 954-322-8586. See you next week on Regenerative Medicine with Dr. Escobar. The opinions expressed on the preceding sponsored program were strictly those of its host